So the last portion of the pharmacokinetics is drug elimination, so the excretion of the drug from the body. Most of the drugs, we've talked about this a little bit already, gets eliminated through the kidneys. So two thought questions to think about is, again, how would exercise affect this, and what would be the impacts of dehydration on this process? We have to look at the influence of a water-soluble drug versus a fat-soluble drug. Obviously, a water-soluble drug will very easily be eliminated through the kidneys. However, lipid-soluble drugs will not. The lipid-soluble drugs will be reabsorbed after it goes through the filtration process in the kidneys. They will be reabsorbed and will not be eliminated by virtue of the kidneys through urination. Another thing to look at is the individual patient's health. Obviously, a patient with insufficient kidney function, physicians will be a little more careful about how they prescribe certain drugs to them via the fact that they will not be able to eliminate the drugs through that method. And looking at the half-life of a drug, remember we said the half-life is how long it takes for half the drug to be eliminated. That will impact elimination as well. So the drug effects will be the highest when the serum concentration is at its highest. So when it's at its highest level at the bloodstream, that's when the effects will be at their peak. The one thing we need to be aware of is with athletes, depending upon what drugs they are taking, we need to be aware of this for eligibility purposes. So if athletes are going to be on a drug that's on the banned substances list, that needs to be taken into consideration. Appropriate documentation needs to be in place, because an athlete, and later on in the semester, we'll be talking about rules and regulations, and that's an important thing to know, just so an athlete that you're working with doesn't get suspended or disqualified because of this reason. We discussed about the concept of half-life, and that will kind of tell you how the drug will be stored in the body and how it will be detectable in those situations when athletes are getting tested. And in some situations with certain medications, they will actually do blood tests to look at the concentrations of the drugs because of how particular some drugs are in as far as their levels and how effective they are, and also looking at side effects of drugs. For instance, seizure medications. Individuals who take seizure meds will get regular blood work done to make sure that they're staying at levels that are necessary for them and also not going above those levels to produce possible adverse effects. So these are some other factors that affect drug response. So 4 things you could look at: infants, older individuals, the weight of individuals, and time of administration. So as kind of a little self-exercise, I would like you to look in your book and write down some things related to each one of these individual factors. So look at infants, older individuals, weight, and when a drug gets administered, to kind of determine how these individual factors directly relate to the drug responses. So as we talk about drug distribution, there's going to be situations where we don't want certain drugs and chemicals to reach certain areas of the body. 2 of the main barriers we're going to discuss here, we're going to talk about the blood-brain barrier and the placental barrier, and the mechanism and how they work to prevent drugs from getting to certain areas of the body. The blood-brain barrier is a protective mechanism for the brain and central nervous system that is basically a collection of capillary walls and grouping of cells called glial cells that do not allow certain substances to enter the brain. Now, that's going to be important in some situations, but in certain situations we're going to need drugs to be able to cross that barrier, particularly when we look at, a good example would be a lot of your very strong pain-relieving medications, your opioid analgesics, that are going to need to be able to reach there to have that strong pain-relieving effect. In that situation, drugs that are lipid-soluble will be able to enter the central nervous system much easier than drugs that are water-soluble. Water-soluble drugs can reach it, but even if they're able to, they do so at a much slower rate. the placental barrier, well, the placenta, as we all know, is a specific structure that allows for a lot of the functions of a developing fetus to be able to grow and develop in the body. Now, the placental barrier is much more permeable than the blood-brain barrier is to drugs, which is important to realize when we look at drugs being prescribed to pregnant women. You have to consider what the possible effects are on the developing baby. So it's going to be important. It should always be looked at as things that would only be recommended. It's always a good idea to discuss with the physician any drugs that a pregnant female may be taking. Now, obviously, many people are on a lot of different types of drugs, so you have to look at drug interactions. Your textbook doesn't talk about this as much, so really kind of pay attention to what we're discussing here. Various factors will determine if there will be drug interactions. The most common things we look at that tend to be negative with drug interactions are either an increase in adverse effects of a drug or drugs, or possibly a decreased therapeutic effect, which obviously could have as many bad ramifications as even increased adverse effects. So we're going to look at some of the different types of interactions and what are some things you need to be aware of when looking at taking multiple meds. So looking at drug interactions, looking at altered pharmacokinetics, altered pharmacodynamics. So with your altered pharmacokinetics, you're looking at, again, it's how the body affects a drug. So when we look at how the body handles certain drugs, I have the example phenobarbital, which is a nervous system drug, accelerates the hepatic metabolism of acetaminophen. So it will increase how fast the body accelerates Tylenol, essentially. So that goes to show you how taking a certain drug will actually affect how the body metabolizes another drug. When we look at altered pharmacodynamics, so now we're looking at how a drug affects the body, there are certain interactions that will change how the drug actually impacts or the specific effects. Now, again, similar to what we talked about earlier, this could either inhibit how a drug works, or it could decrease the therapeutic value of another drug, or it can actually produce a stronger effect, which in a lot of circumstances is not beneficial to individual patients.